Hi, welcome back to my channel. I'm Mental Bear. Today we're going to talk about treatments of depression. For some people, treatment for depression may seem like a lost cause. They more than likely seem hopeless, that nothing will ever help them, and some may even not want to put the chemicals that are associated with antidepressants into their body. I'm here today to try to change that mindset that surrounds treatment with mental health and depression. I'm so guilty of refusing treatment in the form of antidepressants because I was scared to take medicine that could potentially alter, who I felt that I was. It wasn't until I tried antidepressants that they really work for me, and I'm really glad that I did try them. So together, let's try and change the treatment stigma that surrounds depression. The first effective treatment for depression was discovered by the drug known as ibuprofen. This drug was originally used to treat tuberculosis patients, but during the treatment of tuberculosis patients, they found that people's moods were inappropriately elevated and thus began the treatment of depression. So they used this drug as the first antidepressant. However, the side effects of this drug began to outweigh the actual benefit of it. So they kind of tossed it in the trash. But what this did is this started research for actual antidepressants that we know today, such as Cymbalta, Prozac, and Zoloft. The drug also led researchers to the hypothesis that depression involved decreased activity at the norepinephrine and serotonin synapses, which once again led to antidepressants being discovered as they continue to research these different activity levels in depressed people. The way that antidepressants work can be a little confusing. I'm going to try to do my best to make this as simple as possible. However, just like I can't promise that I won't be cringy, I can't promise that I won't be clear. So if you feel that I misrepresented something, I left something out, or you have another take on it, go ahead and leave me a comment in the description below, and so we can have a discussion, because this is what this is all about, right? The basis of antidepressants is that they increase the activity of norepinephrine and or serotonin. So norepinephrine, serotonin, or both. This is done in a few different ways. Some drugs destroy the excess amount of monoamines. Monoamines are basically, they're just neurotransmitters. Norepinephrine, serotonin, and dopamine's included in there as well. While some destroy, some block the reuptake. And atypical antidepressants, they typically select a specific neurotransmitter, such as serotonin with Prozac. Now, this may seem slightly counterproductive to destroy something that makes you feel good. But what happens is that when your body has an excess amount of serotonin, right? So it's producing serotonin, right? Crazy, like, oh my God, this person is so sad. Let's give her some happiness. Woo! Right? So all the serotonin is floating around. And then you have these little receptors, right? And you got the serotonin, and they bind, and then serotonin is released into the body, and you feel better or normal. What happens when you have an excess amount of serotonin is that it doesn't all get absorbed, right? And so the body does two things. The body makes less serotonin and more receptors. So since not all the serotonin got used, the body stops producing serotonin, which leads to depression. And since there wasn't enough receptors before, more are kind of grown, so to speak, but now there's not enough serotonin to fill those neurotransmitters, which causes depression. So I hope that makes sense. If it doesn't, I'm sorry. Next, we're going to talk about electroconvulsive therapy. Now, this probably sounds super scary, and you think of like Frankenstein being zapped back to life, or just turning the brain off and off again, which is literally what they're doing, right? You have a team of doctors and nurses in there, whereas before, it was almost inhumane to do ECT. Like, they didn't put you to sleep, and now they use anesthesia, so you don't remember it. You don't feel the pain. Like, you're groggy and you have some memory loss afterwards, but the benefit outweighs the side effects. Typically, people who do ECT, electroconvulsive therapy, they've resourced every other option to treat their depression. Their antidepressants don't work. And if you remember in the last video, there are certain people who are non-responsive to antidepressants due to that allele in their gene, right? So these people, they don't respond to treatment. They don't respond to CBT. antidepressants, nothing works for them. So the last resort is to turn their brain off and on again. They reboot it. Let's talk about the biological rhythm known as the circadian rhythm. This is basically a 24-hour rhythm that your body goes through that basically says, I'm sleepy at night and awake during the day, right? For people with depression, this rhythm isn't phased correctly. So depressed people often feel sleepy in the early evening versus at night, and wide awake in the early morning versus the normal morning, right? Now it may seem normal, like, oh, well, you go to bed in the evening, you wake up in the morning. Like, well, not exactly, right? So it's not uncommon for people who are depressed to go to sleep at like 5 in the afternoon and then wake up at 1 in the morning and be up all morning. And then, and the difference is that, like, for other people, like your circadian rhythm would typically readjust itself. But for people who have depression, sometimes this isn't the case. And regardless of the previous night's sleep, your rhythm stays the same. And like your body's not self-adjusting to make sure you get enough sleep that you need. And this could be linked to the reason that people may feel so fatigued all the time. And speaking of sleep, someone who doesn't have their circadian rhythm regulated normally also don't spend the correct amount of time in REM and non-REM sleep, right? We're going to focus on REM sleep for now because this is the stage of sleep that depressed people typically spend the most time. REM sleep is known as rapid eye movement, and this is because when people are in REM sleep, their eyes move really rapidly. This stage sleep is also kind of known as the deep sleep, right? Dreaming typically happens here. And people who have a unipolar affective disorder, depression, enter REM sleep earlier than non-depressed people. On the surface, it may seem harmless and almost beneficial for people to have more deep sleep, but excess REM sleep comes at the expense of the other sleep stages. The other sleep stages have been linked to being responsible for the restorative process of cognitive functioning. Fun fact with Mental Bear, 70% of depressed people share the problem of having too much REM sleep at night. Once again, if you saw my last video, you know that there are certain people who aren't responsive to medications. Well, you're in luck, everybody, because not only does ECT work, but resetting your circadian rhythm can reduce symptoms for, up to several months. And while it's not a cure, which there is no cure for depression, there's only treatment, it's better than nothing. It's relatively easy to do, and all you need to do is stay up 30 minutes later than you normally would every night until you reach the desired bedtime. Now, this isn't going to work for everybody, but it's shown to be pretty effective. Let's talk about seasonal affective disorder. In my types of depression video, you'll know that there is a form of depression called seasonal affective disorder, which basically mood changes during the season time. So it's typically associated with winter depression. So we're going to focus on wintertime, right? There's this thing called phototherapy, and it's these like lights, these UV lights, and they're really high intensity, and you sit in front of them for a couple hours at a time, and your mood is elevated. This can be done at a doctor's office, or you can even buy your own phototherapy light. And I'll leave a link in the description below, and you can go check those out. They're fun facts with Mental Bear. Not only does phototherapy lights help with depression for seasonal affective disorder, it also helps with things such as jet lag. So if you're a big traveler, by all means, buy one. You won't feel so jet lagged. A frustrating aspect of treating, mental illnesses and, even like mental health in general is that nobody really knows why any of it works. And this is due because of lack of funding. Can you guess why we have a lack of funding in mental health? I'll wait. If you said because bees are going extinct, you're wrong. You're just wrong. I don't even know why you would think of that. If you said because of the stigma that surrounds mental health, then you would be completely correct. Not even that long ago, cancer was seen as a really shameful disease to have. Some people thought it was contagious, and people went as far as to hide their family members away from the public eye so that nobody would know that they had this family member who had cancer. A lot of people died because of it. There was a lack of research, a lack of funding, because everybody was just scared of the C word. And I don't mean cunt, I mean cancer. And mental health is in that stage right now, right? Everyone's afraid. Everyone's afraid to say they have depressions. Everyone's afraid to say they attempted suicide. People are afraid to say they have multiple personalities. They're just afraid. They're afraid that people are going to label them crazy, or they feel guilty because they have it. They feel ashamed. The mental health industry needs to be treated like the cancer industry was treated a while ago, where people stopped being afraid of it. People stopped being ashamed of having something that's not their fault. And they spoke out, and slowly but surely, like, funding came for cancer. And now it's not unlikely at all for somebody to live a long and healthy life after cancer. Why can't that be the same for mental health? Why do we have to feel shame? And it's the whole reason I'm doing these videos, is so that people understand that just because you take Zoloft doesn't mean you're crazy. And together we can end it. You know, you can share these videos, you can make videos of your own, you can write your congressman, and we can stop feeling ashamed as a community. We have to speak out. Talk to your friends and family about it. For once, fuck the uncomfortableness that follows the words depression, anxiety, suicide, that follow the simplest of them all, which is mental health. Through education and unity, we can change this world. So share this video, comment, subscribe, like, do what you gotta do. Give me a thumbs up to know that you support me in my endeavor of stopping the stigma, of hashtag end the stigma. I'm Mental Bear, and I don't think I will ever have a catchphrase.